Watercutter.
And I'm Neha, Jasti, and we're both students from Centerville High School. And today we're going to touch on cardiovascular surgery.
In our freshman year bio class, Neha and I dealt with a case study involving a patient who suffered from numerous heart issues. After investigating the case study during school, we were able to research the field of cardiovascular surgery. As both driven students and athletes, we identify with many of the personality traits of cardiovascular surgeons, such as competitiveness, time management skills, and a strong work ethic.
A few characteristics that cardiovascular surgeons have are being able to communicate with both their peers and colleagues and also their patients. They also have to be able to deal with a lot of pressure, for the life of a patient is in their hands. They have to be good thinkers and be quick on their feet. Lastly, they have to be able to work long, hard hours and stay on their feet for a long duration, similar to how student athletes have to be fit in order to play long hours in their games.
They'll need to work these long hours as they have many job responsibilities. First, they'll have to operate on the heart and blood vessels if any damage is caused by accidents to the cardiovascular system or disease. They'll have to document and track all of these surgical procedures, including pre-op and post-op care. They'll have to communicate with the healthcare team and the patient. The healthcare team involves cardiologists, primary care physicians, and other surgeons. Finally, they'll have the opportunity to research the heart and blood vessels.
This focus of the heart and blood vessels is demonstrated on our poster. As you can see, there's red and blue string that extends out from the heart to the rest of the poster, similar to how veins and arteries extend out from our heart to the rest of our body, fueling our life functions. This emphasizes how important the field of cardiovascular surgery is, for it deals with preserving and treatment of a very vital organ of ours, the heart.
To be able to work on this vital organ, you'll need extensive training. It takes about 14 to 16 years to become a fully practicing cardiovascular surgeon. First, you'll need a bachelor's degree and a STEM major, preferably biology or chemistry. You'll then need to take the MCAT, which is the Medical College Admissions Test. After that, you'll gain admission into medical school, which takes about 4 to 5 years. Following medical school, you can enter into a residency program for either surgery or internal medicine, which also takes 4 to 5 years. You can then go into your fellowship program for 2 to 3 years, where you'll be able to take the American Board of Medical Licensing exam to become a fully certified and practicing cardiovascular surgeon.
A practicing cardiovascular surgeon makes an average about $420,000 a year in the United States, more specifically around $202 an hour. However, salaries can vary depending on how the surgeon wants to further their career, whether that be with teaching, where they can help newer generation surgeons learn, especially with their extensive knowledge and experience in the field. However, they will experience a decrease in pay, or they can open up a private practice where their pay will increase, but they also have to deal with the difficulties that come with the administration process, financial and legal paperwork, and also running the facility as a whole.
While the field of cardiovascular surgery is very rewarding, there are some challenges that come with it, such as cost. It costs a lot of money to go to medical school, and many surgeons go into debt. 2, you'll also have to deal with time, as it's long, hard hours that you'll need to work, and medical school and all of the education requires a lot of time. You'll also have to be the bearer of bad news at times, as there may be difficulties on the table, and you'll have to relay this to both family and friends. You'll have to deal with malpractice, and the insurance fees for that can be high as well. Lastly, you'll have to deal with the stress of working in such a high-pressure field.
However, there are many benefits to becoming a cardiovascular surgeon. 1, as we mentioned before, salary. With the salary that this type of surgeon makes, they're going to be able to live a sustainable life with no financial worries. 2, job security. The job growth for surgeons in 2020 has increased by 24%. And with our aging population that face both obesity and heart disease, the need for cardiovascular surgeons is at a high. Also, simply helping others, being able to save a life or improving the quality of their life is very rewarding to a surgeon. Lastly, technology. With many new improvements in the medical field, surgeons have been able to improve their techniques in surgery.
One of these examples of improvements is robotic heart surgery. It's only really used in healthier and younger patients, but it's been used in a surgery such as the percutaneous aortic valve replacement, which is essentially a heart valve replacement, but through a blood vessel, which is less work and does not require open heart surgery. It helps with a lower recovery time, more precise cuts, and better stitches. See, this is not being used very prevalently yet, but it could become a new driving force in the field of cardiovascular surgery.
Thank you for listening to our presentation on cardiovascular surgery.